Hello, and welcome to the monthly Beyond What the Doctor Ordered session. For those of you who don't know me, I am Cindy Dupuy, and I'm a functional medicine nutritionist, and I have a private practice in Irvine, California, and I will tell you a little bit more about that a little bit down the road here. So this month's call focuses on preconception care, and it's a topic that I get really excited about, and it's a lot of fun for me because it's helping moms and dads to be create a beautiful and safe environment for that little being that's going to be growing inside. And preconception care is really the best gift that you can give yourself and your baby. So in my email that I sent out announcing this month's topic, I said that this talk would be an overview of a lot of things. So what I listed was the importance of good nutrition and what does it even look like, how to determine both nutrient status and your toxicity levels, the beneficial labs or lab tests that you may want to ask from your doctor in addition to what they've already done, hidden and underlying factors contributing to fertility, repairing and preparing your digestive system for pregnancy, the importance of adequate thyroid hormone levels to become pregnant and to sustain pregnancy, how does the MTHFR gene affect you and your unborn child, how to test for the MTHFR gene, how to wean off medications, diabetes in pregnancy, and the invaluable benefits preconception care can bring to mom, dad, and baby. And it's like, my goodness, whew, that was a lot. And I do think I was just a little bit ambitious to think that I could even touch on all of these topics in our 30-minute time slot that we have here. But having said that, these topics are all important, and I do cover them when I do visit and meet with couples who are interested in preconception care, and they really are all equally important. So with the time frame that we have, our constriction or constraints that we have, I have chosen about 5 of these topics, and it's nice to note that, it's good to note that each one of these can be a standalone presentation, but I am going to touch on each one of these. I feel enough that it will give you some tools to go forward with. So we are going to cover the importance of good nutrition, what does it look like, how to determine both nutrient status and your toxicity levels, beneficial lab tests to ask from your doctors, hidden and underlying factors contributing to infertility, repairing and preparing your digestive system for pregnancy, and the importance of adequate hormone levels in order to become pregnant and to sustain pregnancy. And the hidden and underlying factors contributing to infertility actually will not be a standalone. It will be sprinkled out throughout the talk today. And then also the invaluable benefits of preconception care. Hopefully you can hear that as well as we go through each topic. I don't really need to go through the housekeeping that I normally do at the beginning of a call because this is actually a re-recording of the session that I did yesterday. The audio did not come through too well on the recording, which is why I wanted to go ahead and do this. I would like, though, to make sure that everyone tuning in understands what this call is about. The purpose of these monthly calls is to help you expand your knowledge and offer resources that empower you to ask for and take ownership of your own health. So it's my goal that you become advocates for yourselves and also can have better conversation with your doctors. So that's what this time and conversation is about. I'm hoping to give you resources and guidance to allow you to work, again, with your doctor in a more effective way. The time that I have here with you is brief, and obviously there are not going to be any recorded Q&A at the end of the session because, again, this is a re-recording. But if you have additional questions or concerns, I'm going to ask that possibly you go ahead and email me those, and I'll do my best to try to answer them. And maybe there's more than just one or two questions, general questions that you have, and that's where a one-on-one consultation with me may be the next indicated step. So I do like to let people know how I work with my clients. I do see clients in my office in Irvine as well as virtually. I do have quite a few clients sprinkled throughout the nation. And to find out more about how to book an appointment with me, please visit. I invite you to visit my website at www.alivingbalance.net. Make sure it's .net. So A-Living is ALIVINGBALANCE.net. And also before I jump into today's topic, I need to give a disclaimer. I'm not a doctor and cannot give you medical advice, diagnose, or treat. What I present here, again, is to help you receive better care and direct you to resources that can benefit you. Always check in with your licensed healthcare professional before embarking on any new lifestyle, dietary, or supplement regime, and before changing or stopping medication. So let's begin here. Maybe the first place to begin is, when is the best time to start preparing to become pregnant? Ideally, it would be 6 to 12 months before conception. That does give us time to fix digestion, determine hormonal imbalances, any possible nutritional deficits, and if there are any heavy metal toxicities, to go ahead and pull those out, and to make lifestyle changes, which can include body movement and reducing stress, and just kind of getting everything in order and getting used to a new way of eating. Having said that, I want to make sure that people know that it's not too late to begin preconception care even 1 to 2 months out. So if you don't feel like you want to wait 6 months to a year before you really start moving down this road of parenthood, it's fine to start wherever you're at. So let's start with some basics. Good nutrition. What does it look like? Basically, in a nutshell, I recommend a vegan diet, and it will do most people very nicely. And it's kind of a cross between the Mediterranean diet and the paleo diet. So it's paleo with a plant-based bent and allowing for some occasional legumes, which include beans and lentils. And I'm not a big one for soy, but if you are more on the vegetarian path, you might want to add some soy, but just make sure that it is organic. Some people do have an issue or a difficult time digesting soy. I'm one of them, and I'm sensitive to it. So just be aware of that. I also do recommend a few ancient grains like buckwheat and quinoa and even some oats, whereas paleo does not allow either legumes or grains at all. I recommend cutting out or cutting back on gluten, period, because it can be very inflammatory for a lot of people, and cutting back on grains in general to help better regulate your blood sugar and to allow more room to get more greens, Greens, and good fats, which is really good for your brain and your baby's brain development as well. I recommend trying to eat grass-fed meats and organic chicken and wild-caught fish as often as you can, and try to eat organic produce, fruits, and vegetables, and familiarize yourself with the Dirty Dozen. So Google it if you're not familiar with that, and make sure that everything on that list is an organic must. And I say that because I know that for all of us, eating organic and eating grass-fed can kind of put a dent into our budget. And I like to make suggestions then on how to possibly get around that dent. And that is, you don't have to do everything organic. But again, check out what's on the Dirty Dozen and adhere to being organic with everything that's on that list. And then I'd like to give you some suggestions as far as where to shop to help with your budget. I was going to say something else about that, but I am not sure. So the resistance I get sometimes, so you guys, sometimes I lose my train of thought too. The resistance I get sometimes to eating organic, again, is the price. But I do want to point out that you are worth it and your baby is worth it. And we unfortunately live in a sea of chemicals and pesticides, and unfortunately the generation of the millenniums, which is probably where you fall if you're listening to this, has been exposed to more chemicals and pesticides. And GMOs is what I wanted to bring up. I knew that's what it was. In a way that my generation was not exposed to it. So we need to clean up as much as we can. So yes, I do want to bring up that anything that's also on the GMO list, you do want to make sure you're also choosing organic. So on that list would be soy, would be corn, would be sugar beets, and I'm sure you're saying, well, sugar beets, I don't eat beets. Well, if you're eating anything that says that it has sugar in the ingredient label and it doesn't say cane sugar or it doesn't name the type of sugar, then it's coming from the sugar beet. Canola oil is also GMO, soy oil, obviously. And then cottonseed or cotton is GMO as well as alfalfa. Now, probably you're not going to be eating alfalfa, but I would imagine that many of our cattle are going to be eating alfalfa. And that's one of the reasons, too, that we would like to move towards the grass-fed. Okay, so recommendations for obtaining organic and grass-fed without paying out an arm and a leg. Trader Joe's is one of the stores that I do frequent a lot, and I'm pretty happy with what they have. And even their frozen foods, I'm happy with them for the most part. And then I like to get, and I've been increasing this a little bit, buying my dry goods from thrivemarket.com. And you can get to their website through my website, or you can just, put it in there. And it is a membership store, a small fee, I think of $50 or $59 for the year. So I do recommend that. The prices are about in line with Trader Joe's. And then I have been using Bwtdo, and Bwtdo has grass-fed meats and organic and free-range chickens and pork as well. I'm finding as I get busier and I have less time to shop and run around that I am relying a little bit more on Thrive Market and Bwtdo. And if you live in an area that there isn't something convenient for you to go to, like Trader Joe's or Sprouts or a health food store, this also might be a really nice way of you getting high-quality foods into your house, into your home. So some of my favorite foods to improve egg and sperm quality, and again, this would be, a couple months out, is, which is best done about 6 months out, would be eggs and grass-fed butter, fish oil, and liver, and anything in the cruciferous family. So I'll explain here. So eggs it's pretty much a perfect food, and it has a lot of choline in it, which also helps with brain health and also helps with the liver. I think eggs are a great way to go. There are some people who can be sensitive to eggs. It's one of the foods that are kind of high up there on a allergy level. And I know myself, I used to have a sensitivity to eggs, and since I fixed my digestive system, that's no longer the case. But eggs are wonderful. The grass-fed butter, again, you have wonderful short-chain fatty acids with that. And then fish oil always calms and is always good throughout the entire body, reduces inflammation. And then liver, and again, this must be from a grass-fed source. And I do recommend calf's liver. And the nutrients there would be, again, choline, would be your B vitamins, would be zinc, and all of those are set you up for conception and then also growing your baby and giving them full of really nice nutrients. And then anything in the cruciferous family. So the cruciferous family includes the cabbage, Brussels sprouts, broccoli, kale, watercress, and I know I'm missing a big one right here, and I'm not coming. Oh, cauliflower. That's it. Why is the cruciferous family important? Why those vegetables are? They all lend a sulfur component, and sulfur is one of the building blocks that your liver uses for detoxification. So really good in order to move things out that we don't want in our bodies. I do want to mention that if you have an autoimmune disease of any sort, especially thyroid itis or Hashimoto's, gluten cannot come back into the body. It just wreaks too much havoc and inflammation and can take as long as 6 months to repair. So the gluten molecule is similar to the thyroid hormone, and that is why there's an issue with that. I didn't really mention dairy here. I do allow and recommend dairy to some people, and I recommend it in the form of raw and raw cheeses if that's available in your state. I know at Trader Joe's, at least in California, that a raw cheddar cheese is available. I think they might have a couple other different cheeses. And then I also recommend sheep cheeses like the Manchego and then goat cheeses. The sheep and goat cheeses are a little bit different in composition than the cow's milk, and some people can tolerate that a little bit better. Okay, so those are the recommendations I have as far as diet. Again, that's a quick overview. And let's go to lab work, the lab work that I recommend to request from your doctor. And most of what I've listed here will be over and above what I often see. So the doctor will usually order a CBC and a lipid panel and probably a very basic thyroid panel. But and possibly vitamin D, but I am going to touch on vitamin D here. Always ask for that because it does impact moms and babies' health overall. And vitamin D is essential for bone development, fighting infection and moods, and also to prevent preeclampsia. I like to see fasting insulin, and it's not something that's routinely ordered, but is actually a better marker of blood sugar control than fasting glucose in the A1C. And it's a test that Dr. Mark Hyman always recommends. And for those of you who don't know Mark Hyman, I highly recommend that you look him up. He's a great source of information, and he puts things in a manner that is easy to hear. He's very generous with this information as well. And to kind of drive this home about insulin being a better marker of blood sugar control, I just had a client in last week with perfect glucose and A1C markers, but had a fasting insulin level that was very elevated, which indicates that she was having a problem with blood sugar control and insulin resistance. So it's really good to have a complete picture so that we have a better idea of the risk of perhaps getting gestational diabetes. And this can also be an underlying factor of difficulty in becoming pregnant, as insulin resistance and glucose imbalance, blood sugar imbalance, can be one of the signs of PCOS, which is polycystic ovarian syndrome. And that sensitivity or lack of sensitivity in PCOS can affect our sex hormones, which of course can affect our fertility. The next two that I'd like to see are iron and ferritin. We need about 80% more blood to support pregnancy, and hemoglobin and iron are essential parts of that additional blood supply. So if we don't have enough iron, we're not going to be making enough hemoglobin, and our body's going to say, hey, we don't have enough here to support another life and the pregnancy. Ferritin is our iron reserves or stores. So again, if we're low in either one of these, our body is going to say, don't think so. Our bodies are very, very wise and very, very smart, and we need to give them credit. All right. The next one would be homocysteine. And this marker is often tested by doctors mainly to assess the risk of heart disease, but what I'm looking for here is actually a screening of folate and B12 status and the possibility of having something we call the MTHFR gene, which I will mention again, but the MTHFR gene is a whole other lecture in itself. We do need enough folate and B12 to break down homocysteine. So if homocysteine levels are elevated, we can assume that there's not adequate levels of folate and or B12. And that's good information. And both of these B vitamins affect the ability, again, to conceive and baby's neuromuscular and the baby's nervous system and brain development. And most of you already know that folate is important because you find that it's in higher amounts in prenatal vitamins. I'm going to go back real quickly to the MTHFR gene, and again, I don't have time to really go into it, but I do want to let you know kind of how it works. It affects your body's ability to utilize folic acid and folate, so it's always nice information to have, and there is a way to test for it that is very non-invasive with just a cheek swab. Okay. The last of a complete preconception panel includes a comprehensive thyroid panel, and this panel would specifically include TSH, which is your thyroid stimulating hormone, your free T3 and free T4. I like to see reverse T3, which is an indication of excess inflammation and stress, which we always need to address, but that one's a little bit hard to get from doctors. And I always recommend thyroid antibodies, your TPO, and to me that's a complete and comprehensive thyroid panel. I'm going to give you a quick overview of why all of these markers are important. So let's start with the TSH, which is a thyroid stimulating hormone. And ideally, this chemical reflects the overall level of thyroid hormones. But there's a caveat here. It's produced in the brain, in the pituitary, and the hypothalamus also has an influence here. So it doesn't always reflect that feedback loop that we should be getting from the level of thyroid hormones. So it's not a thyroid hormone itself, which is why I always like to see what free T4 looks as well. And many doctors would do TSH and T4, but they stop there. And to me, that's not good enough because T4, which is a thyroid hormone that your hormone produces, is the active form of the thyroid hormone. So our cells and tissues can't use the thyroid hormone yet. And I do like to point out here that all of our cells and tissues have receptor sites for thyroid hormone. So you can see it's really, really important to make sure that you have enough. Now, the form of thyroid that our tissues and cells can use is the form of T3. So T4 is converted to T3 in our liver with the help of zinc and selenium and vitamin A. So that is why I insist that, or I encourage you to insist to have your free T3 tested as well. So we don't stop at TSH, we don't just stop at T4. The T3 is essential. So studies have shown that low levels of thyroid hormone in moms can result in lower birth weight. It can result in developmental delays of your child and psychiatric problems, delayed motor skills, and reaching cognitive milestones. And it's good to note that developing baby does not start to make his own thyroid hormone until about 12 weeks or so in utero. So he's very dependent on mom. And with this in mind, it's easy to understand why low thyroid hormone levels can be a contributing factor to miscarriages. So I'm going to move on to why testing for thyroid antibodies. It's really important to get a baseline before pregnancy for 3 reasons. First of all, it's important to eliminate the possibility of having an autoimmune disease, and that's what these antibodies indicate before becoming pregnant. And we can have these antibodies without having any what we call clinical symptoms. So that's one. Number 2, a large number, 1 in 17, of women who have elevated antibodies will suffer from postpartum depression because of these antibodies and because they're suffering from a low level of thyroid hormones after they have delivered. And I've never had postpartum depression, but I've talked to some who have, and it is extremely debilitating. And it's really hard when it's a time in your life where, everyone expects you to be joyful and happy you have this baby, and you are. But if you have really low thyroid, and which can contribute to just absolute fatigue and exhaustion and depression, it's really hard to put on that happy face and say, hey, everything is okay, and to deal with this new little baby who's depending on you for everything. So the third reason why it's important is once you're pregnant, your antibody levels will automatically be lowered or downregulated because your immune system has to become less active in order to maintain the pregnancy. Okay, so we have a foreign body in there. That baby it's not us. It's a part of us, but it's not us. So the immune system will downregulate itself in order to make sure that it can maintain the pregnancy. So with a downregulation of the immune system and calming down, there will be less thyroid antibodies produced at that point. So if you try to test for it after the fact, after you're pregnant, we're not going to know if you did have them prior. If there are thyroid issues, I recommend, and it's important to be retested at the 6-week mark and 12-week point during pregnancy as well as postpartum. And thyroid medication may be needed during pregnancy, and that's good to know, and it's okay to take. It really and truly is for you and baby. I know some people worry about taking any type of medication while they're pregnant, and I also caution as well. But in this particular instance, it's really important to have adequate amounts of hormone. Okay, we're going to move on to the next area that plays a big role in preconception, and that is nutrient status. And I'm going to focus mainly on mom's nutrient status because she's the one that's going to be becoming pregnant and maintaining the pregnancy. But this also applies to dad. So there is a way of determining both the nutrient status and your toxicity level. And it's a very good test, and the test that I like to use is called the Nutri-Evolve test from Genova. And it measures the status of most of your vitamins and minerals, including zinc and selenium. And I think I mentioned that selenium and zinc both have a role in converting that inactive form of thyroid, T4, into the active form, T3. That's a must. So it measures that. It measures magnesium, your amino acids, making sure you're getting enough protein and that your body is able to break down and digest your proteins. It measures your ability to remove toxins by measuring your glutathione levels and other antioxidant levels. It screens for yeast overgrowth and also an overgrowth of bad bacteria, or what we call dysbiosis. And then it tests for heavy metal toxicity. And again, this test allows for an easy cheek swab to test for the MTHFR gene that I've mentioned a couple times, and then another gene called the COMT gene, which I like to see. What I like about this test is that it's both a blood and urine test, and again, very comprehensive. The urine is a much more accurate measure than blood to see how your body is utilizing nutrients. So I have often seen blood tests where magnesium and B12 and folate were measured through serum, through blood, and they were normal or high. But when we look at the metabolites in the urine of the nutritive valve, which is where one substrate is changed into another substrate, that tells us what your body is exactly doing with these nutrients that are in your blood or serum. So to kind of give you a visual with this, when you have one substrate and it's converted to another substrate, so you have substrate A and substrate B, okay, so there's a whole pathway of how things are converted throughout our body all the time. To go from substrate A to B, let's say it requires folate and zinc. Now, in the urine, it will measure substrate A, and if we see that we have an elevated amount of that substrate and a low amount of substrate B, which is where it's supposed to be converted, we can make the assumption that your body doesn't have enough folate and or zinc in order to make that conversion. So it's a very direct yet indirect way of measuring and highly accurate. I think that's all I have on that one. So it's possible. I recommend it to all of my clients who are coming in for preconception care. It's not something you have to do, but it is something I do recommend. And by the way, the NutriValve test is covered by many of the PPOs, and there is a copay with that, but it makes it more affordable. Okay, let's move on to repairing and preparing your digestive system for pregnancy. And this is really important. Your gut motility, so how things move through the gut, slows down during pregnancy, which can cause all sorts of problems and discomfort, including heartburn, constipation, and something that we call SIBO. And SIBO is an acronym, S-I-B-O, is an acronym for small intestinal bacterial overgrowth. So if you're experiencing any IBS, constipation, reflux, bloating, food sensitivities, it's a good idea to fix it now. It's a good idea to fix it before you become pregnant. If you have parasites, a yeast overgrowth, or an imbalance of gut bacteria, and or a leaky gut, it is much easier to treat before you're pregnant, as many of the herbs or even medications are contraindicated during pregnancy. So let's take care of it now. And sometimes it's also contraindicated while you're lactating. So it could be a long time before we fix it if we don't fix it ahead of time. If you're taking antacids and have IBS, food sensitivities, there's a good chance that you're also not going to be able to absorb your nutrients adequately, especially your B vitamins and your minerals, which can also be an underlying factor to contribute that is contributing to having a difficult time becoming pregnant. So I've listed at least 4 underlying factors to infertility, or I actually rather would say difficulty becoming pregnant. Acid reflux and low stomach acid, which can happen with stress. It can happen kind of genetically, and also stomach acid is reduced when you take an antacid. These can all affect transit time and your utilization of B vitamins. There's an enzyme that's produced from your stomach acid that breaks down B vitamins, so you might not be able to break them down. And also your availability of minerals like your iron and selenium, again, that's thyroid, and zinc, which is immunity, and iron is part of making more blood. All of this can be compromised as well. Excessive bloating can be an indication of low stomach acid. It can also be an indication of small intestinal or bacterial overgrowth, or SIBO, or it can be a lack of digestive enzymes. All again, they're affecting your nutrient status. So hopefully you can glean and you've gotten that how the gut is an integral part of not only your own health, but thyroid health, and is also an integral part of maintaining a viable, becoming pregnant, and then maintaining a viable and healthy pregnancy. So I don't have time to cover diabetes and how it relates to conception and pregnancy. That's a whole standalone. And again, I don't have time to talk about the MTHFR gene, but I think both of these are very important topics. And woohoo, we get to look forward to listening to these at a different date, and I get to look forward to talking about them at a different date. Both of them I enjoy very much. One last thing I would like to bring up, and I know are a big question for people wanting to become pregnant and who are pregnant, are about prenatal vitamins. Should you take them before you become pregnant? And my answer is maybe 3 to 4 months prior to conception. But that's about it. I do think it's good to take a good, general multivitamin, but much more than 3 to 4 months prior on a prenatal, I am not all for it. And the biggest reason is there's a good amount of extra iron in those prenatals. And unless that you show up that you are anemic, that extra amount of iron can actually be counterproductive because iron is actually a pro-oxidation mineral. And so, you know how we're always trying to eat antioxidants? Well, this is a pro-oxidant. So we really don't want that extra dose for a very long time. So the next question is, what type of prenatal do I get? And this is what I say. The ones that have their folic acid in the form of folate. If it says folic acid, please put it back. It is not going to be giving you folate in the form that we know your body can utilize. Also, probably the quality of the vitamin is not going to be really high. The other thing to check for, you check for all of these on the back, would be your form of B12. It should be in the form of methyl, methyl, and then the word cobalamin. If it just says cobalamin, again, it's not in the most absorbable form. And then B6. So these are just all little checkpoints here. And if they have these, then probably you've got a pretty good product. B6 should be in the form of pyridoxal 5-phosphate. Many times we'll see it in the form of pyridoxal hydrochloride. Again, not the most absorbable form of B6. And then you need to be sure that you read the other ingredients and make sure that there's no added food colorings or dextrose or corn products. It needs to be pretty clean. You don't want to be putting garbage in. So recommendations on brands, here are a few that I like to see, that I like, would be Seeking Health, Designs for Health. I know you can order both of those from Amazon or from me. And then Zymogen is also a very good product, and Zymogen products have to be purchased from a healthcare professional, so you would have to purchase those from me directly. And then Pure Encapsulation is also a very good brand. And there are more out there. I've just given you some tools on what to look for. So look for them and be picky. So I think that is quite enough for today. I've given you a lot to chew on, and I'm hoping that you've been able to hear some of the invaluable benefits of preconception care sprinkled throughout and what it can bring to you as parents-to-be and to your new little baby that you're hoping to have soon growing inside of you. So since this is recorded, I'm not going to have the Q&A session, but I would like to make sure, again, that you know how you can work with me by going to my website at alivingbalance.net. I do have some packages available for preconception care, and then I see people on what I call a la carte basis. Some people just come to see me just one time, and they get all that they need at that point in time. Those that have more difficult issues or something going on with their gut might need to see me a few more times than that, or if they're having problems with miscarriages or getting pregnant, then I'm probably going to be working with you a little bit more. And again, I'd like to remind you that how I see one of my biggest roles is being an advocate for my clients and making suggestions, again, to have better conversations with your doctors and seeing things that perhaps your doctor did not see. I spend a lot of time with you. Your doctors only get to spend so much time with you. So being your second eyes and second pairs of ears and being your advocate is something that I really enjoy being and doing, and I find has been of great service and value to my clients. So I'm hoping that this was valuable to you, and I hope it gave you some things to think about. If I can help you any further, please let me know. And I hope that you'll be on some calls in the future, and be sure to look for the Beyond What the Doctor Ordered call about diabetes and pregnancy, how to manage that, and about the MTHFR gene. All right, everyone. Take care and have a wonderful rest of your day. Bye-bye.